My name is Anshu Gupta and I'm a pediatric endocrinologist and fellowship director of the program at Children's Hospital of Richmond. I've been here about 16 years and I do lots of different things. Some specific things that I do is specifically take care of children with hormone disorders. So that would involve kids with growth problems, puberty issues, and I have specific research interest in children who have polycystic ovary syndrome or adrenal disorders like congenital adrenal hyperplasia. I'm a principal investigator on a clinical trial that is exploring some new therapies for children with congenital adrenal hyperplasia. I'm also the fellowship director for the program, and I will say that working with trainees, medical students, residents, and fellows is definitely one of the very cherished parts of my day and my weeks and my months. Because I just love to see how we train our next generations of physicians and people who are caring and compassionate into taking care of children. I think I have one of the most fun jobs in the physician workspace. I love to be able to see people, especially children who need me, and then also have fun at the same time, being able to give high fives, being able to do a funny face without having to worry about somebody watching me is really the fun part of my time. But then at the same time, being able to use my knowledge to help a child, help a family get through whether it is illness or whether it is getting better with their health is definitely the part I love the most about my job. I know this is very true for many of my other pediatric colleagues, which is another reason why I keep coming back every day, because then I get to hang out with all these colleagues of mine who are childlike as well as super smart people. When it comes to get their thinking hat on, they leave no stone unturned to take care of a child, whether it's in the ICU, in the acute care, or in the clinic. So one of my favorite memories is actually of my first year of being here. I was a very newly minted faculty, and we had a child through World Pediatric Project who had an uncommon pediatric disorder, and we were expecting that the child would be staying in the hospital for a few months. Unfortunately, due to the circumstances, the child's mother was not able to travel with her, and one of the child's wishes was if she could travel back in time for her mother's birthday. And honestly, we did not know. We were about a week from when that might be possible, and we still didn't know. And we just jokingly one day were like, well, we will try, and that lit up that kid's eyes. And it just left this interesting impression of how actually sometimes dreams come true even when you're not thinking, because we were able to get that child back to her mom one day before her birthday, and she got to meet her mom, who I later on found out was actually struggling with a terminal illness and passed away a few months after that child got home. So it just felt like we had made a difference in somebody's life, but also being able to actually get a mother and child together. And some of these things are what keep me pushing through in those moments when things happen that don't go exactly the way we want. I would say I could be either. I was thinking about this question from the perspective of one of my younger kids, and I think he would choose pie, but I think I can go with a chocolate cake or an apple pie anytime.